Patty Stalker here from WestfordCAT, and I'm with Jeff Stevens. We're doing our weekly Zoom update. Though, of course, last week, Jeff, we didn't have our weekly update, but we'll get back on track. How you doing?
I'm good today. How you doing, Patty?
I'm doing good. Stir crazy, but at least
Yeah, I
being it.
think we all are a little bit.
So you're busy. Big reopening, phase two
So yeah,
on Monday.
phase two did open, and it's phase two is coming in two parts. One of the biggest parts that a lot of people were very excited about was the ability for restaurants to be able to have outside seating. And Westford, like many other communities, has restaurants that are really looking to open up their outside seating, and many of them have come up with their plans. And through a collaborative effort through the planning department, building department, police, fire, and health, we're going to those places and making sure that they have not only the proper protection for diners, but to make sure that they're properly spaced and to make sure that the exit plans are in place and everybody's comfortable with how they're doing it. Some other things that we need to consider when doing so is with the expanded seating, we are also making sure that restaurants aren't running the risk of going over their Title V and septic permit numbers. So we also have to keep an eye on that. So there's an extra added layer with this extra seating as the phases open up more. So it keeps us pretty busy as far as that goes. And with some of the other places opening up and baseball fields are opening up for practices for kids to go out and get a little bit of work. Hockey rinks are finally opening, which my son is very happy about, that he's able to practice again. We're just watching all these places to make sure they're staying within the guidelines. And we're not actively enforcing a lot of this stuff. We are trying to make sure that businesses have access to the information, and we're only following up on a lot of these places if we get a complaint that somebody is kind of operating outside what the guidance is calling for.
Are these Westford guidelines or are these state guidelines?
So Westford is following all state guidance. We haven't seen a need to go more stringent than state guidance in any case. In fact, the state does not want us to go more stringent. They want us to stick with the guidance, which just makes it consistent for everybody across the state, which I think is a far better idea than everybody having something a little bit different.
What are the guidelines for restaurants right now?
Well, it's for the health department, the guidelines are to maintain, depending on how you interpret it, 6 feet between tables to make sure that everybody is properly socially distanced. So that distance obviously is in many cases far greater than what restaurants would have typically. And the capacity of the outside is dictated by the amount of space they can actually have. So that's really the challenge. And a lot of restaurants are going above and beyond to make sure there's no communal items such as condiments, and they're using disposable items to make sure that there's no potential transmission of disease. So I think everybody's working really hard on their sanitizing plans, making sure that their employees are properly masked up where they need to be. And they're working hard to stay open. So we're going to try to make it as easy for them as we can.
So you said baseball fields are opening, beaches are opening. How's the social distancing working there?
So the beaches, they have to be 12 feet between blankets, and the general rule of socially distancing has to happen as well, where you got to stay 6 feet away from people if you're at the water's edge. And obviously, if you're going into a beach at the water at the beach, or you're going to go into a spray park, which we actually don't have in Westford, you don't need a mask when you're in the water. That would probably hinder your breathing a little bit. But we've put out guidance, and we're going to have signs at all the beaches on what can be done. We are still discouraging games such as some of the fun ones like the can jam and some of the spike ball games that kids like to play, at least for now. We're hoping that restriction will get lifted as we get better data. But at this point, they are open, and we're asking them to just read the signs and follow the guidance.
So for baseball, obviously you can play catch and you're keeping social distancing. What about basketball courts or
So basketball courts can be used, but you cannot have any tournaments or games on them. So if you can run socially distanced drills with people having their own basketballs, you can do that.
Gotcha. So what else opened in phase 2? What other changes are there?
Well, I think the changes that people are looking for that aren't open yet are more noteworthy. Like retail stores, if they're ready, are allowed to have people in, but you're not allowed to put clothes on and try them on in the store at this point yet.
You're not allowed to put clothes on. Thanks for clarifying that. You mean you can't try on clothes?
Yeah, don't try on clothes. Yeah. So some of the places that aren't open yet are places like personal care services, which are your nail salons, massage therapy, any of the places that do any of the outline body work that you're allowed to have done, such as Reiki, things like that. Those aren't open yet. And that is part 2 of phase 2. And we haven't heard a date. The governor spoke earlier, and I didn't get a chance to listen yet, but I don't think he announced that portion yet.
No, I kind of came in a little after he had spoke because he was late, and he was mostly talking about PPEs and that there's more being manufactured in
he was at a
Massachusetts,
factory, if I'm not mistaken, today.
In Lawrence, yep, yeah.
Lawrence, yes. Mm-hmm. So yeah, that's what he talked about today, and we're hoping soon that he gives us some guidance on when part 2 of phase 2 will open. And right now, we're just trying to make sure the places that can open are able to do what they need, and we're just giving them the best guidance we can. There are some restaurants that aren't opening for outdoor seating yet because they just feel like the effort to do so is greater than they're ready for, so they're going to do it at their own speed. Some are waiting to see what guidance changes so they don't have to continually shift, which that's their prerogative. They can go about that any way they'd like. But any place of business that wants to open, we're more than happy to give the best guidance available for how they're doing it.
How is retail working?
Retail, I haven't had any calls on yet. So I haven't heard anybody say they've had an issue or people haven't had a mask on yet. I haven't actually looked at any of our regular retail stores, such as anything in Cornerstone Square or down by Whole Foods yet to see what's open. I mean, most of our retail is located right on 110 in Westford, so there isn't a whole lot to see, but I'll probably check it out when I can pull away for a little bit in the next day or so to see what's actually open.
So to clarify, are residents required to wear masks?
So anybody in Massachusetts is required to wear a mask when socially distancing is not possible.
Gotcha.
Any place where you go, such as a grocery store and any essential business, are still requiring people to wear masks. Stores can require people to wear masks themselves if they want as well. So if you want to go into whatever your favorite store is and they're requiring that, people will be required to wear a mask. Great
for that clarification. So let's talk some numbers.
Sure.
Looks like things are trending down in the state.
So things are trending down in the state for sure. In Westford, we are currently trending down as well. We've had 139 active cases. We have 139 total cases. 4 are active currently. And that means we've had 122 recover. And there leaves a gap of 13. And I've received a lot of complaints that I'm not reporting that, but I just have not, and I think we've talked about this prior. I generally don't report what the deaths are. It's already a public record. But in this particular case, the number jumped fairly quickly. And I'd like to just give a quick explanation why that was.
Yeah, because I remember when we last spoke on May 22nd, there's 135 cases, 60 active, 70 recovered. So that would have been 5 deaths. So it jumped a bit in a week and a half.
So what has happened is in our congregate care settings, which are our long-term care facilities, We had several cases in those, and those were outlined in the state reporting on how many cases were there. Well, when those cases are reported, they stay in what's known as a cluster, and the cluster does not get released until the entire cluster is resolved, if you will. Within that, there were some people that had some comorbidities, and there were people that were on end of life and hospice care. Some of those people may or may not have died from COVID, but they had it when they passed. Therefore, it's reported in the number. Some of the people in town were not at those facilities and may have had a similar situation. But typically, when the numbers jump that fast, the number that went up was our recovered, and we also saw a spike in our people that had passed because all of those cases were released at the same time.
Oh, I get that now. Okay, that makes sense. Sure.
So when I had 40 plus people, excuse me, resolve, which was great to see, a vast majority of the people that were at our long-term care facilities survived, and they were perfectly fine, and they recovered. And I put them into our recovered category once everybody was recovered.
Well, if you look, I mean, it's certainly encouraging when last time we spoke, there were 60 active cases, and now we have 4. So, it seems like we're doing it right.
So it's going down slowly, and a lot of the other cases that we've had, and I'd like to refer to a case as a person that was designated as positive or confirmed positive. Nearly everybody got better. They went through their disease cycle and they recovered, and they got better. And the nice thing is we've just seen, as this ramped up in March and early April, we would see several positive cases at a time. We'd see 2, 3, 4 a day coming in. And at this point, we are seeing 1 every couple of days, which it's great to see. And we still have some people that are still recovering, and they will come off that very short active list. And I would love to see us fall back down to 0 and stay there for good. But the reality is there is no vaccine for COVID-19 at this point. So once we get to 0, if we ever truly get to 0, we still have to stay vigilant and we have to stay active. That doesn't mean the disease has passed us by. It just means that there's no sick people here.
Gotcha.
And that's going to be important for people to make sure they're still washing their hands, still socially distancing, wearing a mask where appropriate, and continuing to fight the good fight so we can keep our number low. There's been a lot of good hard work by people. And even though I know everybody's got cabin fever, me included, that is looking to get out of their house, we're still going to have to do a little bit of work on just the hand washing. I still think is one of the most important things we can do. And making sure we're wearing a mask is also right up there when we're out in public.
Yeah, what we're actually, I just have to reiterate, the mask isn't for yourself. The mask is for other people. So when people don't want to wear masks because they, for whatever reason, don't feel like they're going to get COVID, but really it's not for you, it's for others.
It's really for everybody. That's really the goal. It's for the common good. And there are people that may or may not believe in it, and they are difficult to wear, especially in the summer. But wear them where they're appropriate. The state says you need to wear a mask where socially distancing is not possible. So do that when you have to go out. And obviously, you can't wear a mask when you're about to go eat. That's going to be impossible to do while you have got a mask on. Although I did see a really neat invention where somebody made one where it had a trap door where you could put food in.
I saw that.
As much as I like that, you won't catch that on me.
I saw that. There was a woman sitting there. It was like a plexiglass thing with a door. Yeah, I saw that too.
Yeah, I probably won't use that myself, but it's just going to come down to people making smart choices and just being cognizant of your surroundings and doing the best you can with it.
Till
And
we
I
get that.
till we get a vaccine.
Yep, till we get a vaccine. This is the new norm.
Hopefully, if we see the numbers continue to trend down, and I would love to see the state drop down to nobody in the hospital, and at that point, maybe we'll see uh, the state open up even more. What we don't know yet is this going to cycle through, or is it going to stay long term? And even though I don't have that answer or truly know, I'm probably going to err on the side of caution and think it's going to be here until we can vaccinate against it, and just try to be aware.
We have a graduation and town meeting. It's going to be on the football field. Have you talked at all with Jody and the board, the select board members about that?
So the town meeting is going to happen,
Mhm.
and it's
On
going
June
to
20th, which is
Yep.
next Saturday.
and the plan is going to have all the residents spaced out far enough that they are meeting social distance requirements. And we're going to make sure, we're going to ask everybody to have masks on when they're there. And with the understanding there are some people, whether it be for their own medical reasons, can't wear one. We certainly understand. And we'll make sure we have some available for people that don't have one that may have forgotten it. So the meeting is going to happen, and we will make sure that it is run as safely and as cleanly as possible.
And WestfordCAT will be there recording it
Sounds good.
for those who can't make it. So, all right, Jeff, anything else you want to let residents know?
I think that's the only update I have right now, as we just try to continue and get through the reopening process. If people have questions, they're more than welcome to call us, and we'll do the best we can to get people the answers they need.
Great, Jeff. Thanks a lot for you and your team over there in the health department, keeping us safe.
Thanks, Patty.
All right, take care. We'll talk again next week.
Sounds good.
For WestfordCAT, I'm Patty Stalker.